Good afternoon, good evening, everyone. My name is Andrew West. I'm the policy associate with the education advocacy team here at the Colorado Coalition for the Homeless. And what I'll do tonight is give sort of an overview of the data and the current state of homelessness in Colorado and nationwide for Black Coloradans. But what I want to do before that is just give us a bit of a starting point, recognizing that all of the data that you will see today and the current landscape of homelessness in Colorado and again nationwide is really closely and intricately tied to the history of slavery, segregation, widespread discrimination in financial, housing, lending practices, and racist systems that have occurred in the past and are also ongoing today that produce these really wide discrepancies that we see and that we'll describe in the areas of income, health, housing stability, and that these are not anything specifically tied to any one racial group. I'll also note that we will use the terms Black and African American interchangeably today, sort of referencing data based on what each data source uses to be accurate to the data. But obviously, when we are speaking to any individual, we want to use the term that is preferred by that individual. Next slide, please. Thank you, Gabriella. A bit of a demographic overview. I'll note that about 4.1% of Colorado's general population, almost 250,000 people, identify as Black or African American alone. When you consider people that identify as Black and African American in conjunction with other races, that percentage is about 5.5%. And this is not evenly spread throughout the state. There is a higher concentration of Colorado's Black population in Denver. That's about 11% from the most recent census data that I've seen. Next slide, please. And nationally, Black people account for about 13% of the population, but we know that there are some pretty wide discrepancies in who experiences poverty. About 1 in 5 of people living in poverty are Black or African American, and also much higher likelihood to be unhoused. So about 37% of the unhoused population and half of homeless families with children also identify as Black or African American. Looking at the data breakdown, this is per 10,000 people. So about 59 per 10,000 people who experience homelessness are Black or African American. This is not as high as other racial groups like Native Hawaiians or other Pacific Islanders and Native Americans, which we've covered in a previous education series presentation, but is significantly higher than the overall population across all ethnicities and much higher than the white population as well. Some national trends between 2022 and 2023, the largest increase in sheltered homelessness. So people who are staying in some sort of shelter or mostly that are not in any immediate unsheltered location. The largest increase was among African Americans. So that was about a 14% increase year over year. And 45% of people who are in shelters identify as Black, and 26% of people in unsheltered locations. So we do see a higher percentage of the African American population that is sheltered versus unsheltered. And we know some of this data isn't perfect. There can be a lot of different things that influence that data, but this is generally the trend we see across multiple sources as well. And overall, nationally, Black Americans are over 3 times more likely than whites to have experienced homelessness at some point in their lives. So that might not be currently, but that's lifetime prevalence. When we get a bit more specific to Colorado, looking at the local context, the 2023 point in time count data shows about 2,400 unhoused African American or Black individuals and families. About almost 400 of those individuals are unsheltered, and the rest are in some sort of sheltered location. Again, that's about 4% of the general population in Colorado, but a vast overrepresentation as almost 17% of people experiencing homelessness are Black or African American. This is the same thing that we see in the Metro Denver region. We actually just got some point in time count data from the continuum of care from the Metro Denver region that shows about 3.3 times overrepresentation. So while they are only, I don't have that specific number for Denver, but about 23.5% of the homeless population in Denver, but much less of the general population. And here is that point in time count data from 2023 broken down. As we get more data for 2024, we'll put that together in a report and share, but you can see pretty clearly some wide racial disparities across who experiences homelessness versus the Colorado general population. Next slide, please. And I'll give a bit more, now that we've got that data, I'll sort of provide some further data to give more of a background of why we see these discrepancies. I obviously mentioned earlier that these are products of both long-term past historic inequities and intentional systems of racism as well as current ones. And we've seen over time that some of these have actually gotten worse. Between 1970 and 2021, the Black and white home ownership gap has widened pretty significantly. So that's the difference between white Coloradans that own their home compared to Black Coloradans. That gap increased from 19% in 1970 to almost almost 30% in 2021. That's 28% gap. In 2021, Black Coloradans were almost twice as likely to be renters, to be renting their home than white Coloradans. And for renters, they are also more likely to be behind on rent and at risk of eviction, which we know is one of the number one causes of homelessness. So these housing discrepancies are, again, products of really intentional policy and societal choices that have pretty directly led to these discrepancies that we see produce homelessness. And a bit more data broken down. So this is looking at Black renter households and both the risk of eviction and their likelihood of being evicted in the next 2 months. This is self-reported, as well as how likely they are to be behind on rent. And you see that across both of these metrics, Black individuals are much more likely to face housing instability. So concerns about eviction and inability to afford rent and to pay rent on time, which pretty directly, again, lead to homelessness. Further breakdown, this is describing renter cost burden. So for those of you who have not heard this term before, the cost burden describes when you are spending more than 30% of your monthly income on housing, that is considered cost burdened. And that's the point where we find that difficult decisions need to be made, that it becomes difficult to afford your housing along with healthcare, food, and all transportation, all the other things that a household needs. And severe cost burden describes when you're spending more than 50% of your monthly income towards housing. So the orange slides indicate the cost burden for different racial groups across the United States, where that darker shade is the severe burden, so that's over 50%. And then the gray squares describe the data in Colorado. And again, we see that Black households are much more likely to experience both cost burden, but especially that severe cost burden when compared to other populations and compared to the total in Colorado overall. Health, we know at the Coalition that health and homelessness are really directly intertwined and that poor experiences of health and homelessness often go hand in hand. We know that negative health outcomes can lead to homelessness, sometimes by creating financial shock. And we also know that the experience of homelessness itself can have a really negative impact on health. And we see, again, these discrepancies that Black Americans are more likely to receive unfair treatment, discrimination, and other negative experience in seeking and receiving healthcare, and also have higher rates of being uninsured, worse supported health status, and less access to care overall. So when we look at access to healthcare, that is a really direct contributor to who is likely to experience homelessness. There are a lot of health discrepancies and a lot of health data. To not dive into that too much, I wanted to just highlight the overall mortality rate among Black Coloradans is significantly higher than that of white residents. And that's for the general population, not just those experiencing homelessness. But we do know that the mortality rate and life expectancy for the unhoused population is also much higher than those who are housed. I want to point to some discrepancies in criminalization as well. For the housed population, Black people are incarcerated at more than 5 times the rate of whites, and the imprisonment rate is twice as high for Black women compared to white women. We see the same thing for people who are unhoused, who are really disproportionately likely to face criminalization and face criminal charges because of the way that we treat homelessness in both our state and our country. Black unhoused persons are about 10 times more likely to receive a citation for laws criminalizing homelessness, so criminalizing daily activities that would not otherwise be illegal and punished if you were not unhoused. And I believe some of this data is actually from Eric's report, which we will discuss a bit later. So shout out for all this great data. I want to highlight mass incarceration as well. There's a really, again, direct relationship between experiences with the criminal justice system and experiences of incarceration and likelihood to become homeless or experience homelessness for any point of time. If you have been to prison, you're 7 times more likely than the general population to experience homelessness. And this is about 13% if you've been incarcerated multiple times. A lot of this data is included in a report that we've put out both on myth and facts related to criminalization and homelessness, as well as our criminal justice one pager as well, if you'd like to dig into this a bit more. But again, we see pretty clear and severe racial disparities. The incarceration rate for African Americans has increased over the last 50 years and is now more than 6 times the rate of white incarceration. And although Black men comprise about 13% of the overall male population, it's about 35% of those who are incarcerated. And last data point on this is that 1 in 3 Black men born today can expect to be incarcerated in their lifetimes, compared to 1 in 6 Latino men and 1 in 17 white men. And this history of mass incarceration and ongoing mass incarceration is very well documented. We'd be happy to send out some more resources on that as well. And then I believe the last thing that I'll cover here before we move on to our panel and highlight some solutions is the impact of generational poverty and the wealth gap overall. This wealth gap has increased as a result of the pandemic and is now about $240,000 for a household. And that describes how much a Black household earns for related to other races and related to white households in particular. Black and Latino children are more likely to be living in poverty compared to white children in Colorado, and this is the case nationwide as well. And last thing I wanted to mention is the experiences of ACEs, or adverse childhood experiences. So these are negative experiences, oftentimes that are very traumatic, that are experienced during childhood, that are strongly correlated to a large number of outcomes later on in life. And one that correlates pretty well is the number of adverse childhood experiences and homelessness. And these were found to be significantly higher among Black youth, and a really telling reason why so many people are experiencing homelessness. And one of the ways I saw something in the chat that it's a strong point that we can look at towards intervention, and I definitely agree with that. Next slide here. So what works? Before we hand it over to our excellent panel to talk about it more, I just want to point to the need to really understanding these past effects and these past systems and how they are tied to what we're doing today. I think a lot of times people are tempted to look at the past as something that has already happened and that is not continuing. And we really need to interpret our current practices and systems as a result of those historical inequities. And in doing so, we can create policies that directly address the needs of those who have been most impacted, and implement solutions that are really targeted to those who are most in need. This is something that we're often pushing for at the coalition, making sure that public resources are targeted to those with the greatest needs, so people living at low incomes and at high risk of homelessness and housing instability. And last thing, provide trauma-informed services and representational care. We know that people are much more likely to get better health care when they feel that their providers represent them and their experiences. So that's something that we want to advocate for as well. And I believe that's the last of me. Let me know if there are any questions in the chat, any data resources I can send along, and we'll be happy to send these slides out afterwards as well. Thank you very much.
Great, thank you. Thank you so much, Andrew. That was a really lovely presentation. And for those who are asking in the chat, we will be sharing the presentation out after via email. So all that data is available to you, and it will also have the references. So you can go to the source data and find out more. So now I would love to introduce our panelists. I will go ahead and read all bios, and then we will get started. Patrick, I apologize we didn't have a photo for you, but then everyone will be pleasantly surprised when you come off camera. So first I'd like to introduce Representative Leslie Herod of District 8. Representative Herod was elected in 2016 as the first LGBTQ African American in the General Assembly, while receiving the highest number of votes of any candidate running in a contested election. She serves as the chair of the House Finance Committee, vice chair of the House Judiciary Committee, and chair of the Committee on Legal Services. Rep. Herod also chairs the Colorado Black Democratic Legislative Caucus and the Arts Caucus. So welcome, Rep. Herod. Next, we have Dr. Terri Richardson, who has over 34 years of experience as a clinician, health educator, mentor, speaker, and volunteer in the health arena. She retired from clinical practice 3 years ago, but continues to be an active community doctor. She primarily volunteers with the Colorado Black Health Collaborative, or CBHC. Dr. Richardson is vice chair of CBHC and one of the leads for their barbershop/salon health outreach program. So welcome, Dr. Richardson. Next, we have Eric Tars, who serves as the National Homelessness Law Center Senior Policy Director, leading the development, oversight, and implementation of the Law Center's policy advocacy agenda to cultivate a society where every person can live with dignity and enjoy their basic human rights, including the right to affordable, quality, and safe housing. Eric helped spearhead the launch of the Law Center's National Housing Not Handcuffs campaign and has served as counsel of record in multiple precedent-setting cases. Welcome, Eric. And finally, we have Patrick Wilson III, who serves as managing director at St. Clare's Ministries here in Colorado. St. Clare's offers short-term respite from the harsh realities of homelessness, poverty, and the separation felt from God and each other. St. Clare's is an open, welcoming, and diverse community that provides physical and spiritual nourishment, clothing, and other support to guests and volunteers in need. So welcome, Patrick. All right, so go ahead and get started. I like to start as we always do, where we've all seen this data presentation. Gabrielle, if you can just stop sharing screen. Thank you. So this question's to anyone and everyone who's on our panel today. Now that you've seen the data presentation, is there anything that surprised you? Is there anything that you think is missing in terms of the big picture of Black Coloradans' health and homelessness that will help to set the table for today's conversation?
Well, hey everyone, State Representative Leslie Herod here. Happy to be here with you. Unfortunate for the circumstance. I think there is not a lot of surprising data that we're seeing here. We know that African Americans and Black folks are represented disproportionately in a lot of areas that are, quite frankly, underfunded and under cared for, if you will. So I don't think it's surprising. What I would say is surprising is the fact that you all have dug a little bit deeper. And I really appreciate that, really understanding how the intersectionality plays into the overrepresentation of African Americans as unhoused people, right? And so I appreciate that, and I look forward to having more conversations about that because I think that's what shouldn't be surprising that we're having that type of analysis, but quite frankly, it continues to be. Homelessness does not exist in a vacuum, as we know, and you guys are really leading the way in pointing that out.
And I guess I'll go next. And I appreciated the fact that you led with the historical context. Some people say that was 400 years ago, but we know the tone was set back in the day when Black people were treated as property rather than people. And now we're recognized as people, but the lingering impact of that. I wasn't surprised at anything, but I always say to people, we're in Colorado, one of the healthier states. And when we see these type of data, we have a small Black population, and we continually to see these gaps in a healthy state like Colorado, it is really kind of sad to me. And I think some of it is related to, we thought about the redlining and all that and what happened and where Black people could live when they were housed. But now we don't even have a neighborhood. We no longer have a central point that we can call, this is our neighborhood. I grew up in Colorado. I'm not an expert in the unhoused, but I grew up in Colorado back in the 60s. We had neighborhoods and we were connected, and that was our bond. And I think that people were mentally more healthy and probably physically as well. So I'll just add a few things right now since there's others on the panel.
I was somewhat not surprised, but I think the depth of the disparity did surprise me. One thing that I thought was missing has to do with where African Americans, Blacks are located in the city. We're a service provider, and we would have to be extremely intentional in order to reach where most of the Black folks live. So I would like to know where that is, to see a map that shows exactly where our target group should be.
And Patrick,
And
just to interject, I think we're in Aurora more than we are in Denver. I think a lot of people have moved out of Denver and into, I mean, there are some pockets, but I think we're dispersed in various places in Aurora and other places.
Yeah, and I love the presentation as well. I just had two things. One is that you touched on this a tiny bit, but you know, marginalization is intersectional, and when you have compounding forms of discrimination, compounding marginalized identities, then the harm can be compounded as well. So we know that even though that statistic of the homeless population, the national homeless population being 13% Black, but the homeless population being close to 3 times that. The stats are even worse for LGBTQ men from 18 to 25. 1 in 4 of them have experienced homelessness. 51%, more than half of Black transgender women have experienced homelessness. 59% of American Indian transgender women. And when those folks are out on the streets, you heard the statistics earlier about Black men being, or Black adults being 10 times more likely to be targeted for enforcement of those low-level offenses. You can imagine it's even more so for a Black transgender woman is going to be even more hyper-targeted. And then the last thing I would add is that each one of those unnecessary and arbitrary and targeted use of law enforcement against people experiencing homelessness is a potential source of violence, is a potential interaction. We know data from San Francisco shows that although homeless people make up only 3% of their population, they make up 1/3 of the use of force incidents by the San Francisco Police Department. And so if your issue is that Black Lives Matter, then your issue has to include homelessness and criminalization of homelessness, because this is the pretext and the place where so many of those encounters begin. And the solution to this, we can address police practices, but the best solution to this is to make sure that people are inside, housed, so that they don't have to be criminalized, they don't have to be targeted in the first place. And that intervention obviously will have many other beneficial impacts, but people's lives are literally on the line here.
Thank you all so much for those insights, really getting the conversation going. Representative Herod, our data presentation doesn't dig too deeply into the historical policies and impacts, but of course, as we've all said, we see those impacts in the lived experience of Black Coloradans today. Can you tell us a little bit more about SB 53 and other ways that legislators and voters can work to counter historic inequities in health and housing and more?
Absolutely. Our bill, Justice for Black Coloradans bill, really looks at a lot of the areas that you pointed out. Where are the disparities for Black people in Colorado as it relates to housing, as it relates to economic opportunity, as it relates to education and incarceration? And we never really have had a comprehensive study stamped by the state of Colorado to say, here's where policy, right? And here's where historic actions have continued on today to have a true impact on progress for Black Coloradans now. One of the things that I think is important to think about is, as Dr. Richardson mentioned, people say, oh, this happened years ago, or there was not even slavery in Colorado. That does not mean that there wasn't policies that have a disproportionate impact on our communities that have been put in place and are still here. Right. And so when we look at things like redlining in Denver, where Black people weren't allowed to live in certain areas of this city and weren't then able to have the generational wealth that others were able to benefit from, we can see why the generational wealth gap exists amongst Black Coloradans. But what are the specific policies and lingering policies that have laid over that continue to be on the books? And most importantly, what do we need to do to right those wrongs, right? What I think is interesting about the report that you put out and why it's so important to look at these intersectionalities is the Black experience is unique, right? We're not a monolith, but we are unique. And the interventions that we must put in place to ensure that Black Coloradans thrive may not look the same as the interventions in place for white Coloradans or Latino Coloradans, right? Indigenous populations. I truly advocate for making sure that we have interventions and programming set up that specifically address the concerns and unique needs that relate to our cultural backgrounds and the historic trauma that we've experienced. And so that's really what our bill does. It will look at the historic inequities, current policies and practices in place, and then what needs to happen to rectify some of those wrongs. Listen, I've been involved in policy and politics for like over 20 years here in Colorado. And I can't tell you how many times we have talked about the achievement gap, right? Why young Black Coloradans, why our young people are not able to graduate at the same rates and high school and then go on to college. If you don't think that that has a direct relationship with wealth, with the wealth gap and of unhoused Black Coloradans, then you're not looking at the full picture. And so that's really what we're trying to do with this study in partnership with History Colorado as we bring all that data to the forefront.
Awesome. Thank you so much. This question's for Dr. Richardson. As a physician and founder of the Colorado Black Health Collaborative, can you tell us more about what your organization does and how medical health professionals can better serve Black clients, both housed and unhoused?
Okay, are you giving me like 2 hours for this?
I'll have to jump in at some point and start waving, but I know it's a big question.
And I'll start out with the Colorado Black Health Collaborative. Our mission is to achieve health equity in Colorado's Black community, which is a daunting task because as you have demonstrated here, we're at the top or the bottom of every list. But we were actually formed by the people, for the people, about 16 years ago. I think our birthday might have occurred earlier this week. But we were given the charge from the community to continue the work to try to improve the health of Black Coloradans. And there's a number of reasons why the stats are the way they are. And we talk about the social determinants of health, which includes the education, housing, etc. But we have the beautiful opportunity with being with Colorado Black Health Collaborative to hear about what's going on in the community. And we talk about healthcare access. That's one stat that may be surprising to people, that a lot of our Black Coloradans actually do have some sort of health insurance, but just having a health insurance card doesn't ensure that they're getting into the system, that the access is not good because people do not trust the systems. It's not every person, as Leslie said, we're not a monolith, but there's many people that we even hear from that say, hey, we were trying to get into the system, this, that, and the other happened. We want a provider that looks like us. No one was willing to shake my hands, look me in the eye, even touch me, even getting a physical. So we do hear those sorts of concerns from our people. And so here we have health insurance, but we still have an access problem. So CBHC has tried to meet some people where they are, going into the barbershops and salon, and we tell them we're not your provider, but we're there to try to get a few metrics that they can share with providers, try to talk about health advocacy, self-advocacy. Here's the questions you can ask your doctor. If you're still having problems, feel free to reach out. But we must still work with the system because that's where all the tools really are. But we try to give our clients, our people, some tools that they can use when they're going into the healthcare system. But everything that we're talking about today is the reason why we have these gaps. I've also learned that from people that are incarcerated that they have to return to the same zip code that the crime where they were living when the crime might have been committed, but yet with the neighborhoods being gentrified, who could afford to find a place to stay in those areas? But CBHC is small, but we try to do what we can to connect people to resources, to find out what the issues are. We try to advocate. We try to work with the legislative people, the city council people, to kind of right some of the wrongs that have been going on for a while. So I'll stop right there. If there's additional questions, I can come back a little later.
Thank you so much. This question's for Eric. Your report from the National Homelessness Law Center entitled Racial Injustice and Homelessness and Housing in the United States informed our data presentation and covers a wide range of impacts. Section 3 concentrates on mental health and racial injustice. So I was wondering if you could tell us more about how mental health and racial justice are related for Black Americans in the data that you presented.
Yeah, so I mean there's so many of these intersecting trends that you touched on. The lack of access to healthcare and health insurance in general means that many Black Americans don't have access to mental health care in addition to other forms of health care. And historically, despite that, Black Americans and other Native American and minority populations have been overdiagnosed with certain mental disorders, schizophrenia, and other things that makes it more likely that they are going to be placed into involuntary commitments, into different ways that their liberty will be curtailed, their autonomy will be diminished, and they can be placed into essentially jail-like circumstances. Also, because of the lack of actual mental health facilities, community-based care where folks should be placed, often the jail is the mental health care facility of default in many of our communities. In some places, more than half the people in a jail are there with some sort of psychiatric or mental health disorders. What we've seen in recent years, alongside the push towards more criminalization of people experiencing homelessness, has been also, the misuse of the civil commitment system. Involuntary commitments is another way of basically being able to move people off the streets, out of public view, and into places where their liberty can be curtailed and people won't have to look at them anymore. And this because of again the disparate impact of homelessness on Black communities, this historical overdiagnosing of people of color with these mental health issues. You can see that this is a threat that's applicable to everybody, but particularly acute for the Black community. And then the last thing I'll say is that this is something that is growing. The threats of the use of these civil commitment approaches. There are efforts across the country to lower the barriers to getting people into involuntary commitments so that it's easier. There's a concerted effort by an organization called the Cicero Institute, which is trying to pass template legislation in states all across the country that criminalizes homelessness and has one element that would lower these barriers to getting into involuntary commitments. They are mostly targeted at more red states. However, even deep blue California recently passed a law creating what they call care courts, which similarly lower the barriers to getting people into these involuntary commitments. This has been championed by supposed super progressives, Gavin Newsom, London Breed, and others. So wherever we are, we need to be on the lookout for these kinds of misguided efforts that are only going to harm the people in our communities and actually make it harder to end and prevent homelessness.
Thank you, Eric. And I'll say that whole last bit, I was mad that the react button doesn't have like thumbs down. Like when I hear Cicero Institute, I'm like, ooh, and then there was nothing. So I just had to wait and mention that. Dr. Richardson, if you don't mind, I'd like to jump back to you just because we're talking about mental health. If you happen to have any thoughts because you're doing, direct care as a clinician here. I know that you're not specifically working on mental health, but, more physical health. But do you have anything to add in terms of, Eric's work is much more national, or some studies from other cities? Just if you happen to have anything to add in your experience in working with clients, and mental health.
And we know mental health is a huge issue, particularly after the pandemic. Everybody's mental health has kind of taken a hit. What we hear a lot with CBHC is people are still trying to find that congruent provider. We still are at a race-conscious country, and the systems are racialized and the structures are racialized, and people are feeling like they can't get their needs met unless they have someone with that lived experience. And again, there's still a lot of stigma within our communities, and we've had a few projects trying to address that issue of the stigma. Like, it's okay to not be okay. But then when people are trying to access the system, they don't always get their needs met. Sometimes there's long wait lines. If you can imagine, if you're unhoused or lower income, the resources that are available to you are, limited. And I know that Representative Harrod has done a lot of work in the mental health space. In fact, she has a Caring for Denver foundation that was formed based on her work. So she's been a real champion, but it's a big issue. And, we get calls from people who say, we can't go to these systems as they exist. We've got to have something that we can connect with, providers that have lived experience. We don't have to spend all of our time trying to explain the trauma that we faced, the stress of being Black in America. And so I think Representative Harrod could probably add a bit more as well.
Yeah, sure. Happy to. And before we go into that, I just want to ask Eric to please send me some more information on those care courts, because they are finding their way into the Colorado dialogue right now. And so I'd be happy to share that. So thank you for bringing that up. I learn something every time I sit with these experts. What I will say when it comes to mental health is, Caring for Denver was created because I saw the impact specifically of lack of providing mental health care to people outside of the traditional systems, right? We were seeing ourselves funding it predominantly in the in the criminal justice system, but additionally in the child welfare system. What happens when you use incarceration to deal with mental health and substance misuse issues, right? What happens? Well, what happens to the families? What happens to the kids? You're creating this generational trauma that then the state taxpayers and local governments are still paying for. Why aren't we funneling those dollars instead to providing good quality mental health care with people who look like us? So Caring for Denver is looking at systems of care. We're looking at youth mental health, but additionally, we're looking at expanding access to providers of color and LGBTQ providers so that you can get help the way that you need to. One of my favorite programs is Make a Chess Move, where we're funding this organization to play chess with young people, to teach young Black and brown kids how to play chess, but they're doing it with a mental health professional. So instead of having this high barrier, scary, let me talk to a mental health professional and I have to go to this place, instead they're learning how to deal with everyday issues with someone they have grown to trust, right? And to have fun with on a regular basis, quite frankly. And so we have to think about providing these services differently because, again, these systems have created trauma that people don't trust. I'll tell you, my sister was in and out of incarceration for 30 years, specifically around mental health and substance misuse that we way too late found out was because of sexual trauma she faced in her teenage years, right? And never had access to mental health care. Instead, always had access to a direct path to prison, right? To short-term incarceration. And that's really what she got. And it wasn't until a group that wrapped their arms around her and said, you know what, we can do this differently. Even our family wasn't equipped to provide the care needed because we hadn't dealt with our trauma either. It's generational. And it's hard to find a mental health therapist that looks like us that kind of gets it. Right. And so now that she has graduated from college, and she is older than me. So I also have to give credit for having the courage to go back. Right. And now she is providing support in a a housing facility for people and women specifically who are formerly incarcerated. And she's able to provide resources and services to folks who need it. And it's quite empowering. But then on the flip side, I think about the fact that I care for my mom as well. And as someone who's going through dementia, and I know you deal a lot with this as well at the coalition, if she doesn't have a therapist of color, right, she's not getting the full treatment that she needs because she doesn't trust it. And as she goes into some of those spaces where she doesn't necessarily know where she is, what she does know is that she's been harmed by white people, right? And that she can't trust folks, even though she's a medical professional, that don't look like her. And so we've been on a journey right now to find care for her, mental health care specifically, that reflects the needs that her needs, right? And so as we think about those who are providing the services for specifically Black Coloradans who are unhoused, there are great organizations like the Coalition, right, that really care and really are embracing those issues. But we also have to fund organizations that are in our communities, that have longstanding trust in our communities, that know how to do this work in partnership. And that can be scary for a lot of funders, quite frankly, because they might not have the accreditation or the big things on the wall, right, that white-led organizations do. And we've got to stop thinking like that if we actually want to provide progress. Because if we looked at anything from those numbers, our takeaway should be what we're doing now is not working.
Thank you so much. And we did put the Caring for Denver website in the chat. And yeah, they're doing amazing work and funding really diverse causes and really, I think, grassroots efforts. So definitely check out their work. Patrick, thank you so much for being patient. I got a question for you. So you're at St. Clare's Ministries and you all work directly with serving people experiencing homelessness. Can you tell us more about your services and how you and other organizations work to serve Black Coloradans specifically? And if you have any best practices to share. Sorry, Patrick, you are muted, so I apologize. Just unmute and start again if you can. Thank you.
St. Clare's Ministry was started in 1970, basically making sandwiches for the homeless. We've evolved now to having a full meal once a week, which is quite good, by the way. And also we have a clothing closet where people can obtain fresh clothing at no charge, toiletries, all of that, at no cost to them. One of the things about reaching out to the Black community specifically is that we're located in the Baker neighborhood of Denver. And as Dr. Richardson pointed out, that's not where Black folks are. And we're an arm of the Episcopal Church. And so where it goes, so goes programmatic dollars. And so one of the things that I have been doing is attempting to connect with Black church congregations to let them know what we do and how we do it. One thing I did want to address also, someone mentioned fear. And fear and what I call self-segregation. A lot of whites don't feel comfortable dealing with Black homeless. And a lot of the Black homeless don't trust the white service providers. And so that's been a problem with regard to outreach to the Black community.
I'll just add, Patrick, I would love to get your thoughts on this. And, I just think with the things that Eric said too about incarceration and what your experience is, it seems like it's also harder to find unhoused Black Coloradans because, again, we're not congregating in the same places. We are in and out of incarceration. We are less likely to trust care workers, so we're not showing up, we're not in those same spaces. And so are you experiencing that as well? And what, I guess I'm sorry to jump in, but how are you dealing with that?
Well, I'm just completing my first year as managing director. They've never had a Black one before.
Mm.
So the sensitivity level was certainly different. The focus was different. I'm working to change all of that by connecting with Episcopal congregations as well as Black congregations, but Episcopal congregations located in Black communities.
Mm-hmm.
There are some, they do exist. And we're trying to focus more on being inviting, getting the word out to Black communities that we are available, being in the downtown area, as we talked about, that makes that kind of tough.
Mm.
But we are pressing on in any event.
Thank you.
I think that's great because when we talk about equity, whoever needs it the most, you need to give people what they need. That's equitable. And you recognize, hey, the people aren't here, but we're going to go to where the people are. That's the point of a lot of the work that we do, is meeting people where they are. Maybe eventually people will trust the system more. And I've certainly have talked to a few systems about how can you get to that level of trust? You can't just sit back and like, why don't they trust us? And it is,
Right.
part of our role to try to, take care of our people, meet them where they are, but also to try to press these systems. What can you do? How can you extend yourself meeting people where they are? Don't expect them to all come into you because the trust isn't there. The word trust has been mentioned more than any other word today. Even though we're talking about the unhoused and homeless, we've heard trust multiple times, and that's a big issue of why people are not getting the help that they need and do not access these systems that are in place.
Yeah.
You're right, Dr. Richardson. I just wanted to add that with regard to this trust issue, in the Episcopal Church, the Episcopal Church is largely a white church. And so anything that it does comes with kind of a penumbra of whiteness that sort of overshadows the services that they're trying to provide. And so trust is connected to other racial disparities, our history, and it's reflected in the work that we try to do at St. Clare's.
Mm-hmm.
Thank you, Patrick. And I think that's a really what you said and also what Dr. Richardson said about trust is, there's a huge mistrust of systems in the Black community. There's a huge mistrust of systems in the homelessness community for good reasons on both sides. And also so many systems are inherently built from whiteness, right? And so, Patrick, your conversation about how to do that in the Episcopal Church is something that is happening at most established organizations, because if you've been around 40 years or 60 years, or have power or have money, you probably have whiteness in the founding blocks of your organization without realizing it, right? And so unless there are concerted efforts like Caring for Denver is doing to provide funding to organizations that are specifically more community-led and grassroots-led, or otherwise, like starting from those organizations, you're having to both do the work and counter the innate whiteness that is, of course, impacting that lack of trust in a lot of communities. So thank you all for that. This is sort of a question for anyone. We're covering a lot today: housing, healthcare, historical equities. If I think we've sort of covered this, but if anyone has anything more to say about sort of the compounding impact of disproportionalities and our distrust of systems.
I mean, I think, what else to add? I think we have to really look at this incarceration piece, it's generational trauma. I saw someone in the Q&A really did ask about, about housing, right? And about what can we do to get providers of color to stay and all this stuff. Well, providers of color are also experiencing those historical inequities, even though they're providers, right? And so they're not staying in Colorado because it is simply too expensive, right? Or because they don't feel like they have a community home to then serve. And so making sure that we think about that, right? I mean, we think about making sure that they are getting paid equitably and acknowledge the fact that probably for their entire career, they hadn't been, acknowledge the fact that they probably are compounding their student loans in ways that we don't see in other populations. So if you want to really embrace and make sure that that providers of color stay, you have to provide that reparations, if you will. You have to provide the opportunity to ensure that they can afford to stay here in Colorado, right? That they're getting their needs met. Our staff at Caring for Denver, we have very strong conversations with them about ensuring that they are seeing their own mental health therapist, right? To make sure that they are thinking about their financial well-being so that they don't tend to fall off the cliff as well. I myself, as a Black woman, am doing this as well, right? And so I think it's just so very important that if we think about wanting people to stay, we don't just say, please stay, right? We've got to make sure that even if people look a certain way, me and Dr. Richardson look a certain way, right? We got to acknowledge that we have experienced historical trauma too, right? And it's harder and harder and harder every day for us to do this work and be able to survive in these communities. And sometimes it's easier to go to a community that's either more embracing, more affordable, or where you can provide more for your family. That's why they don't typically stay in these areas. Again, at Caring for Denver, we are looking at providing funding so that therapists can actually go through the hours they need to become fully licensed therapists, and be able to pay for that so that that financial burden is taken away. These are just one step and one part of the process that we can do. And so I think if we think about the historical inequities, we think about the trauma, we think about housing, incarceration, all of that, you might look at me a certain way and not think that my sister was incarcerated, period, right? That my nephew is still incarcerated, right? And so really understanding that the disparity happens at every level, and every type of Black person, and then applying some type of intervention, some type of action to rectify that, I think is really key and extremely important. And if you turn a blind eye to it in your organization or in your work, you're not going to be successful. And so I just wanted to add that to the layer as well, is that it's not just the folks that we're serving, but it's the people who are doing the serving, and it's the communities that we are asking to embrace folks from these communities that also need the support.
Thank you. This question's for Eric. Many recommendations at the end of the document you created, which we put in the chat, are related to criminalization reforms. We will be dedicating next month's session to criminalization and homelessness in general, but can you explain more? You go into some detail about the UN Committee on the Elimination of Racial Discrimination and their report and findings, and just sort of the data behind that.
Sure. So the U.S. Is surprisingly a party to the UN Convention on the Elimination of All Forms of Racial Discrimination. It's one of 3 human rights treaties that we've actually signed and ratified back in 1994. This is a treaty that recognizes that racial discrimination, including structural, historical forms of discrimination, is a violation of human rights. It calls not only permits, but calls for special measures to make up for historical discrimination, i.e. reparations, or affirmative action, whatever you want to call it. The standards in it are better than we have in most U.S. law, but it's an incredibly underutilized tool that many people are quite deliberately not made aware of because of exactly those things. And if you look back at the history of the UN and the international human rights system, you saw that actually the NAACP and other racial justice organizations were some of the leading proponents of the international human rights system. But as soon as they actually tried to start using it, they filed the very first petition to the UN Human Rights Committee called "We Charge Genocide," talking about Jim Crow behavior in the South in the 1940s as genocide. Then everybody was like, oh, wait, we can't do this. And so, they were pushed very deliberately away from the system of human rights to the civil rights, the domestic system, as a venue for their advocacy. And there's a whole great book called Eyes Off the Prize that goes deep into this history, and it's a quick read if anybody's more interested in that. But all this to say, there's this great system of international human rights law that recognizes historical injustices, that calls for reparations, for remedies. and the UN Committee on the Elimination of Racial Discrimination reviews the U.S. every few years for its performance under the treaty. We submit these reports to highlight the record. The U.S. submits its own report and often kind of whitewashes things. And so we say, no, this is what's actually going on. And the UN called for the abolition of laws criminalizing homelessness. And that abolition term is not a word that they use lately. It really harkens back to the original abolition movement in their framework, and echoes the current movement towards abolition of law enforcement as well. And I think important to say here that doesn't mean we throw away the law enforcement system and do nothing. It means that we provide safety, security for people in the community by actually meeting their needs, and not through law enforcement, which actually, doesn't meet their needs and only preserves safety and security for a limited few. So we have these recommendations from the international level. We have the UN calling us out and saying the US is out of step with international human rights norms. The US likes to see itself as this shining city on a hill, and we're not. These are the top experts from around the world calling us out, calling us to account. And we can use these recommendations in our advocacy, in our legal advocacy, in our policy advocacy, and it adds one more layer of validation for the concerns that we're bringing to say, this is a treaty that we have signed on to. We've told the rest of the world that we're upholding it. But look, we're not doing it here. And here's some very clear steps. We can stop criminalizing homelessness. We can put in place incentives for communities to put their efforts into more constructive programs, like the mental health 24/7 mental health care outreach, crisis intervention teams, those sorts of things outside of the law enforcement system, so that we can start repairing the harm that's being done to communities. And yeah, so it's just a matter of actually learning about these systems and then using them as part of our advocacy going forward. You are on mute, Alexis.
Thank you. I appreciate it. Representative Herod, what's on the horizon for the next legislative session to continue your work at the intersection of racial justice, health, and housing? I think similar to my question to Dr. Richardson earlier, you're like, I could use 2 hours to answer that, but if you can give us a bit of info.
Yeah. Well, you know what? I'm term limited, so it won't take me 2 hours because I will not be back in the next full legislative session, though we will have an extraordinary session in a couple of weeks. And that session, we're looking really at property taxes. And I got to be honest with you, the property tax conversation is not one that I think will have a huge direct impact on the population we're talking about, or even Black Coloradans, because as people mentioned in the chat, it's unaffordable here in Colorado, and affordable housing is still not affordable for so many. So when we talk about this property tax relief, it's really just not going to touch the issues that we're talking about here. Even though we talk about renters possibly making or being able to get breaks on their rent, it's just not how things work. We know that, right? Like, we could just be honest about that. So I think in the next session, though, the Black Caucus has really some exciting work that we're focusing on when it comes to Black maternal and infant health, right? We're having a lot of conversations about disparities within the health sector, and specifically if there's any remedies once discrimination is faced and how easily accessible those remedies are. Because a lot of folks don't know how to utilize the Civil Rights Commission, right? A lot of folks don't know what medical malpractice could look like, especially as it overlaps with race, right? And so we are doing a lot of work around that. And then additionally, I think there is some progress coming when it comes to making sure that there is more services that are provided instead of incarceration for those who are unhoused. We created STAR here in Denver, and I'm proud that Caring for Denver was the first funder. I saw it cahoots out of Eugene, Oregon, and I was blown away. I said, we have to do this in Denver, and quite frankly, we came and did it. STAR is support team assisted response, where now we have, when you call 911, you usually get fire, paramedics, and police response. That's it, right? That's what you call 911 for. But now in Denver, you also have the opportunity to have STAR, which is a mental health professional and an EMT, as opposed to law enforcement, not necessarily a co-responder, which we also fund, but as opposed to. So we have an additional prong to our emergency response system. What we've seen is those calls traditionally have been a lot of times for those who are unhoused and those who are in mental health crisis. And so what we have also found, though, is that we have referred 0 people to jail through those calls. So whereas law enforcement may feel like their only opportunity and their only option is to bring someone to jail, right, if they can't de-escalate soon enough, START has not had to do that. Instead, we provide relationships with community-based partners, and we're able to also get people there. I think the key here, and I think what we're trying to really push, is that you can't think you can do a 5-minute, 30 seconds, or even 20-minute intervention when someone's in crisis, right? And think you're going to have a good outcome, right? I mean, Terri will say, excuse me, Dr. Richardson, my friend, will say the same thing. Like, sometimes we need a longer time to get the care that we actually need to get. Caring for Denver can be on a call for over an hour. Sorry, STAR can be on a call for over an hour, 2 hours in some instance, but we have that positive outcome, right? And we're saving taxpayer dollars because people are not going into the prison system. And I think that's really important to note. And so we are able now to have that data to say we have to start doing things differently. And quite frankly, law enforcement is saying they don't want to respond to these calls anymore anyways, right? They're not equipped. They don't want them. And so please, someone else come in and intervene, and we're able to provide the resources for that. And so for me, I think a lot of the legislature's conversation is around adequately funding the priorities of ensuring that people are not just routed into jail. And that's a tough conversation. You know, as the former chair of the budget of the Appropriations Committee, it's not easy to say that this is a priority, but it has got to be. And so my ask to folks who are listening is please come and join the legislative process, especially January through May, and help us to understand the policies that are being presented before us and what maybe the possible better solutions and outcomes can be and are. And so please reach out to your legislator. Please share this information. I'm so excited to see all the people asking for the slide deck here, because I know that that means they're going to send it to somebody else, you know? Please do that, because that's the only way that we are informed and knowledgeable enough to make the best decisions for our constituents and for your friends, families, and neighbors, our friends, families, and neighbors. And so I believe in the Colorado General Assembly, we're going in the right direction, but we are at a place where that can go backwards. There are people who are trying to undo the police accountability legislation. There are people who are trying to say we no longer need to fund specifically based on, you know, race or income or things like that. And we've got to say, no, we've got to keep going in the forward direction, not backwards.
Thank you so much. And that leads beautifully into our final question before we turn to the Q&A, which is just what can folks do? You know, a lot of our community members join us for these, and they want to know what they can do to assist neighbors and impact policies. So you'll notice in the chat, we have the number for STAR. If you're in Denver, I highly recommend just save it in your phone and have it ready to go if you need it. But any of our
I'll jump in and say,
Yep.
sorry, I just got to jump in and say, the one thing that we really are disappointed in and that we continue to try to fund and to find the resources for is because STAR is not 24/7. And I tell you what, as soon as that phone shuts off, we get a call, right?
Mhm.
So it has got to be 24/7, and I need everyone's support to get there.
Great. Anyone else with recommendations for those who are watching in with us today?
I think just folks need to be engaged, need to watch out for these Cicero inspired bills and other things. And we know that in the wake of the recent Supreme Court case, Johnson versus Grants Pass, many communities are taking that as a green light to engage in criminalization of homelessness. We need people to speak out to say that this is not actually a good way to end homelessness. It's going to actually prolong homelessness, make it worse in our community, create incredible harm in the meantime that's going to be disparately impacting communities of color, Black people in particular, also in Colorado, Native American communities. The people who are have traditionally seen themselves as service providers and just kind of doing the day-to-day work and tried to steer clear of the advocacy work. Another piece of the template Cicero legislation comes after the funding for service providers and tries to take it away from the proven housing first, housing and services type approaches and put it into short-term emergency shelters and legalized encampments, other things that aren't actually getting people into housing. They're just pushing people out of public view. And so, yeah, unfortunately, you need to get political on this. And the last thing I'll say about that is that HUD, recognizing that it's often difficult for service providers who are receiving funding from multiple sources, federal government, states, and local governments, says that they will actually give you more points on your application for federal homelessness funding if you can demonstrate that you are taking steps to end criminalization, to educate people in your community about the harms of criminalization. And so that can give you the political cover to be able to say, look, like, HUD has said we're supposed to be doing this. They can take away funding if we don't speak up on it. So that's why we're here tonight, telling you why criminalization is terrible, harmful, and stupid. So yeah.
Yeah, and I would just add that I think that a lot of people are not aware of the situation of the unhoused, folks that are struggling. And sometimes it's easy to just, put your head in the sand. It doesn't involve me. But I remember seeing some of our former neighbors that were unhoused. But I just think people there needs to be an increased awareness. Like I know there's some organizations on this call who can take it back to their membership. And we need to spread the word. And people are talking about it, particularly in the Black community. We need to reclaim community. We've lost our neighborhoods, but do we have to lose the community? We have to come together. One person spoke at a webinar that we had, and she said, this is not the time for us to be apart as a people. And we seem to be drifting away. Geographically, we thought maybe that was a bad thing to be segregated, but we had more unity. And I think that and Dr. Daddio used to say unity in the community. Well, people are saying that's kind of fading away just when we really need it the most. And so we need to learn about this situation, be willing to help your neighbor, reclaim our community. And then part of it, to me, the unhoused, when we talk about affordable housing, we have people reaching out. How do you get to the front of the line when there's a new unit that's being built in our old neighborhood and we can't get to the front of the line? So people need to be aware of the issue, we need to help people get to the front of the line because there's some groups that know how to get there. As soon as before the ground is broken, there's some groups that are already there, putting a claim on these low-income houses. So those are the things that I would add. Let's reclaim our community. That could be helpful and start spreading the word and trying to help support one another in these difficult times.
Okay, I'll go ahead and ask a couple of questions from our Q&A section. Thank you to everyone who put something in. We have a question from Alicia that is, what exactly are we calling affordable housing? I ask because even when they call it affordable, you still spend more than half of your income by paying just rent. At this rate, none of us will ever be homeowners. So I'll do a quick pass at that. I would ask that, Andrew, if you could put the great affordable housing report that you worked on in the chat, that would be great, because I don't know who wants to read 29 pages, but there's a 29-pager and then there's a 3-page summary. But it has a lot of really great information. I would say in general, yeah, what we're doing at the coalition is we work to push for anything that considers affordable housing to be 30%, right? That's where people are extremely cost burdened. 30%, 50% of the area median income is what you make to be able to access affordable housing. And then you should be able to, afford your rent because you're only putting 30% of your income to affordable housing. That being said, that's not often what gets considered affordable, right? We think of capital A affordable housing and lowercase a affordable housing sometimes. And a lot of folks think 80% AMI or 100% AMI because we're finding that nobody feels like it's affordable. Middle class people don't feel like Colorado's affordable, and they're right? That's what the data shows us. But if you're in a room with the coalition and we're talking about affordable housing, we're going to be pushing for that lowest level income to be the starting point, because if you start with people at 100% or 80% of AMI, and then you think that the housing is going to trickle down to the people with the least, that's not how economics works since the Reagan era of the 80s, and that's not how housing works. Filtering or trickle down is not effective. So you'll always see us in the room pushing for that, starting with the most affordable, and going from there rather than starting from the middle class out. I'm sure Andrew could answer it better, but I know we have a lot of great panelists. So if anyone else has a good answer regarding affordable housing, would love to open that.
I mean, I think you got it. Like, you're not going to have home ownership you can't save. You know what I mean? And I think the person in the chat as well. So you got it.
Yeah,
Okay.
The only other thing that I'd add, everything you said is right on. 30% of income is what we usually shorthand for affordability in this country. At the international level, the human right to housing classifies affordability as the amount you can pay and still meet your other basic needs. So it's kind of a relative scale. So if you are choosing between paying your rent and necessary medications, or paying the rent and nutritious food, then your housing isn't affordable. So like that 30% is a great shorthand, but I actually like the international human rights definition because it offers more nuance, particularly in cases where, for example, some communities have historically been denied access to healthcare, and those costs are going to be greater. Then even that 30% might not actually represent affordability for you.
Thank you so much. I apologize. We are at the end of time, so I know we didn't get to too much within the Q&A, but we just had such wonderful conversation with the panel. And so, but we do want to wrap up as we're hitting time and respect everyone's time this evening. Thank you so much to our panelists for joining tonight. I think we had a wonderful conversation. The chat was going strong, and we will be sending an email with all the information and as many of the links from the chat as well, so that anything you missed, you can find when we send that follow-up email tomorrow or Monday. Gabriella, if you can do the share for us, please. Also a good time to thank our team here on the education and advocacy team within the Colorado Coalition for the Homeless. Thank you, Gabriella, Shannon, and Andrew, for all the work tonight, and Aubrey and Kathy, who aren't with us this evening online. Please do join us next month. We're going to talk about criminalization and homelessness beyond Grants Pass. Thank you, Eric, for giving us a good preview of a lot of what we'll be covering in that. That'll be next month on Thursday, September 19th. And then in October, we'll be going a week later than usual. We're usually the third Thursday of the month. It'll be the fourth Thursday in October. And we'll be talking about youth and teen homelessness, institutional causes, and proven solutions. And then we'll have one more in November to wrap up this year's education series. And in December, as usual, we do not do the education series because we are doing the Homeless Persons Memorial Vigil that month and want to dedicate our energy to that. So thank you all so much for joining today. Thank you to the panelists. Thank you to the staff. And thank you so much to the people who joined us tonight, our community members who, chose to spend their Thursday night this way learning. And we'll see you all next month. And please do take the survey. That's how we decide what topics we cover. So take the survey, tell us what worked, what didn't, and that'll help us to inform what happens in 2025. Thank you.